The foregut is extended from esophagus to the upper duodenum. What is covered by the midgut? Lower duodenum to proximal 2/3 of the transverse colon. What is the extent of the hindgut? Distal 1/3 of transverse colon to anal canal above the pectinate line. Esophagus to upper duodenum. Foregut. Lower duodenum to proximal 1/3 of the transverse colon. Midgut. What structure covers the distal 1/2 of transverse colon to anal canal above the pectinate line? Hindgut. In respect to the midgut development in embryo, what occurs at the 6th week of gestation? Physiologic midgut herniates through umbilical ring. What ring structure is used by embryological midgut to herniate during early gestational development? Umbilical ring. What happens to midgut in the 10th week of development? Midgut returns to abdominal cavity plus rotates around superior mesenteric artery, SMA, total 270 degrees counterclockwise. Embryological midgut develops around which vessel? Superior mesenteric artery, SMA. What direction does the developing midgut rotate? 270 degrees counterclockwise around the SMA. What are ventral wall defects due? Developmental defects due to failure of rostral fold closure, lateral fold closure, or caudal fold closure. What are the example condition of rostral fold closure failure? Sternal defects, ECTOPIA CORDIS. What is defective in embryogenesis for the development of ECTOPIA CORDIS? Failure of rostral fold closure. What are examples of conditions due to lateral fold closure during embryogenesis? OMPHALOCELE and GASTROSCHISIS. OMPHALOCELE and GASTROSCHISIS are due to failure of lateral fold closure during gestation. What kind of embryological developmental failure lead to bladder exstrophy? Failure of caudal fold closure. Etiology of gastroschisis. Extrusion of abdominal contents through abdominal folds, typical right of the umbilicus. Which ventral wall defect is characterized by abdominal contents outside of body without coverage by peritoneum or amnion? Gastroschisis. What is OMPHALOCELE etiology? Failure of lateral walls to migrate at umbilical ring leading to persistent midline herniation of abundant contents into umbilical cord. Which condition has its abdominal contents outside body and covered by peritoneum? OMPHALOCELE. Which are important associations of OMPHALOCELE? 1. Congenital abnormalities, trisomies 13 and 18, Beckwith-Wiedemann syndrome. 2. Structural abnormalities, cardiac, GU, and neural tube. Abdominal contents covered by peritoneum newborn. DX. OMPHALOCELE. Which fold failed to close during GI development in gastroschisis and OMPHALOCELE? Lateral fold. What is congenital umbilical hernia due to? Failure of umbilical ring to close after physiologic herniation of the intestines. Failure of umbilical ring to close after the intestines herniated. DX. Congenital umbilical hernia. What are the tracheoesophageal anomalies? 1. Esophageal atresia, EA, and 2. Tracheoesophageal fistula, TEF. What is the most common tracheoesophageal anomaly? EA with distal TEF. Esophageal atresia with distal tracheoesophageal fistula is the most common tracheoesophageal anomaly. What is often presented with EA with distal TEF? Polyhydramnios in utero.